Welcome back to NurseEdScholar. So we are going to continue our Stop Fearing Dosage Calculation series. We are now on episode 9. Um, we're going to be talking about IV rates, IV pump rates, so milliliters per hour. And I'm going to go by, 3 calculations step by step, and then we're going to do a case study talking about some clinical judgment. Okay. So, like I always do, let's start. So you have a patient and they have 1,000 milliliter uh, IV fluid ordered, and it's supposed to run over 8 hours. Okay. Um, so now you go into your patient's room, you look at the pump, and it's asking you for one number, and that is milliliters per hour. So what number would you enter? Would you enter 125? Would you enter 80? Would you enter 1,000? Okay. More importantly, how do you know? IV pump calculations, if they make you nervous, really this lesson is going to be for you today. And I think, well, so in episode 8, we learned about drops per minute. We talked about gravity IV flow rates. But today, we're going to talk about milliliters an hour, and that calculation is for your IV pump. So by the end of this lesson, like I said, we're going to calculate IV pump rates, looking at milliliters per hour. And as we work through the problems, I want you to really kind of notice something. The calculations, they should be much easier when you understand what the numbers mean, instead of really trying to always memorize a formula. And like I said, we're going to go through 3 different calculations. We're going to start kind of simple and have something some I guess some a little what challenging, and then like I said, we're going to finally go through an unfolding case study where you're going to have to decide whether the rate that you calculated is actually safe for your patient, and that's what you're going to see a lot in practice. So I want you to get your calculator out, get some paper, and get your pencil. you know I want you to remember that we're not rushing through these calculations. We're going to go through them so you can understand what you're doing and why. Okay, so always before we calculate, I always want you to kind of understand. I know that, if you're watching this video, you may know more than someone else, but I always want to make it to where this is enough information for anyone who's watching. So let's kind of start with the basics, okay? What does milliliters per hour actually mean? So you're going to see it as ml and then a little slash and then HR. And so when you're looking at milliliters, that is the amount of fluid. And then HR means hour. Okay. So milliliters an hour just actually means how many milliliters should the patient receive every hour. That's it. So if I tell you give 1,000 milliliters over 8 hours, what I'm really asking is, okay, so if you divide the 1,000 milliliters evenly across 8 hours, how many milliliters will you be giving the patient every hour? And that is what we're looking for. And I think once you understand that question, the formula becomes much easier for you. So let's kind of connect episode 8 to episode 9. So in episode 8, we talked about gravity infusion. If you remembered, we were calculating drops per minute, and I showed a picture of a chamber, and then there's a little roller that you would roll to kind of adjust how many drops were going into the chamber. Because, like I said, we are manually counting the drops in the drip chamber. Now, with an electric fusion pump or your IV pump, we are programming the pump for milliliters an hour. So if an exam asks you, at what rate should the nurse program the IV pump, that should immediately make you think milliliters an hour. Okay. Um, Another difference between IV pumps and gravity is for a basic. milliliters an hour pump rate calculation. You do not need the tubing drop factor. Okay, let me say that again because this is a common exam mistake. If you are calculating basic IV pump rates in milliliters an hour, you do not use the drop factor. Okay, remember, when you use drop factor, you are calculating drops per minute in gravity tubing. Okay. And hopefully that distinction alone can save you several points on your medication proficiency exam, your calculations on your pharmacology exams, or your regular nursing exams. All right. So let's look at the basic formula. The basic formula is the total volume in milliliters divided by total time in hours. So that will give you your milliliters per hour. So milliliters in your numerator, hours in your denominator. So you have milliliters, numerator, hour in the denominator, and that's going to give you milliliters per hour. That is our foundation. But there's one catch. Sometimes the provider writes the infusion orders, that time in minutes instead of hours. So if that happens, you're going to need to convert those minutes into hours, or you can use dimensional analysis. So you can kind of get the units, you know how you cancel out units, you can calculate them or cancel them out correctly and calculate the problem correctly. But don't worry, we're going to kind of look at both. Sometimes it's funny as you're working, some things will just be quicker to you. So instead of using dimensional analysis, other times you'll use ratio proportion. And so there's two ways of looking at it. But of course, as problems become more complicated, especially when you get into like the pediatric population or you're doing ICU, dimensional analysis would really be helpful for you. All right. So right before we get to the first calculation, I always want to look at the calculation roadmap, okay? So before you start any question, you want to ask yourself, what's ordered, okay? What total volume must the patient receive? Then what's available? What IV solution or medication do you have? What am I solving for, right? So for today's lesson, we are solving for milliliters an hour. Then you're saying, do my units match? Is my volume in milliliters? Is my time in hours? And then you'll say, okay, well, do I need to convert? Do I need to convert? Do I need to convert minutes to hours? A lot of different steps, but you kind of do a lot of them together. Then you're going to set up your dimensional analysis. You're going to solve. Um, you're going to round. Okay, you round based on the pump capabilities and the institutional policy. Okay. Then after that, does this really make sense? Does the volume, does that make sense? Like if you're supposed to give 1,000 milliliters in 8 hours and you're setting your pump or you're doing your calculation and it's, I don't know, 750, you should say, man, that something just doesn't sound right about that. Because 750 over 8 hours, that's a lot. That's way more than 1,000. So, and it sounds silly, but sometimes you're so nervous, you just don't think. So you have to stop and think about these things. And then lastly, is the rate safe for my patient? I mean, for some people, some rates may actually be too fast. Certain populations, it may be too fast. It may be too much. Even if clinically you're looking at a patient, you're like, well, yeah, they need this. But whatever other comorbidities they may have, it just may not be the right thing for them at that time. And so, you know, the rate being safe, that goes through the entire series, because like I've said before, the math can be correct, but is this clinically safe, for my patient right now? I always say right now because your patient's condition can change. So what you're about to give to your patient, is it safe for them right now? Because it could be unsafe for them. Okay. All right. So let's begin. We're gonna start with our first problem. So what do we have here? So the provider ordered 1,000 milliliters over 8 hours. So let's just say it's normal saline. Okay, 0.9% sodium chloride, so normal saline. Okay. And so what is it asking? So they're saying run 1,000 milliliters over 8 hours. So the question is really at what rate should the nurse program the IV pump? Okay. Then you look at what's available. You have 1,000 milliliters of IV solution available, and we are solving for milliliters an hour because we are using an IV pump. Now, yes, I have the dimensional analysis there and your answer. Um, but it would be good right now for you to kind of jot it down. With the next slide, we're going to talk about step by step. How would you really answer this question? Okay, so when we're looking at it, step one, what is actually ordered? What's ordered is 1,000 milliliters. Over how long? Over 8 hours. Okay. So do our units match? We are looking for milliliters an hour. So yes, it matches. Our volume is already in milliliters. Our time is already in hours. So there's no conversion that's needed right here. We're going to set it up. We have 1,000 milliliters in the numerator, 8 hours in the denominator. Okay. So milliliters divided by hours gives us an answer of milliliters an hour. And that's exactly what we need. So you would take the 1,000 divided by 8, and that would give you 125. So our answer is you will set the pump at 125 milliliters per hour. Okay. Now, does it make sense? So let's think about it. If the patient receives 125 milliliters an hour for 8 hours, so you can do 125 times 8, it gives you 1,000. So great, perfect. It works. It makes sense. Now, before you would even connect your patient, let's look beyond the math, right? What should you think about? You need to see one, is this the correct patient? Before you hook them up, okay, I did all this calculation. Did I bring this into the right room? So is this the right patient? Is it the right solution? Do you have normal saline? Is it the correct volume? We need to run a liter. Do you have a liter bag? Sometimes you may not, but for this one, you have a liter bag. Is the time right? So did it actually say on the orders to run it over 8 hours? Okay, so you did that. Now you're wondering, is the IV site patent? Now, one thing, when you start nursing and when you start working in a hospital, at every shift change, when you go in to do your assessment, you should be checking that IV site for patency. If the patient is not getting IV fluids going, then you should flush that IV because you want to make sure that it's patent, that it's not leaking, there's no redness, there's no swelling, anything. Because something may happen, an emergency may happen, and you go and you're like, oh my goodness, the IV site isn't working. It has blown, anything. And now you don't have access. Please don't let that happen to you. Okay, let's move on. So you want to make sure you check the breath sounds. You're about to give this patient 1,000 milliliters of fluid. Yes, it's over 8 hours, but you want to make sure that the lungs are clear. Does the patient even have edema? If they have edema, if they have swelling in their legs, you're like, okay, I'm giving them a lot of fluid, but they already have edema. Are they fluid overloaded already? Right? That's why the assessment is so important. What's their blood pressure? If they're volume overloaded, that blood pressure is going to rise. So you want to check their blood pressure, urine output. Why is that important? If you're looking at your eye and nose intake and output. So you're looking at your eyes and nose, and you're noticing that in that output, not a lot of urine's coming out, right? But they've been receiving fluid. Check for edema, check the lungs. You want to, check their heart sounds. You want to look for their kidney function. Are things working properly? Okay. Because one thing that you have to remember is the pump doesn't know your patient. The pump only knows what number you put in it. You as the nurse are the safety system. You, right? And so if you don't do your due diligence to make sure that the patient is safe, the pump surely won't. Right? Okay. All right, let's do number two. So, let's see. So you have a provider order. So let's just say, let's see, provider orders to infuse 250 milliliters of an IV antibiotic. Okay. Solution over 90 minutes. What's available? You have a 250 milliliter IV, bag of antibiotic. And you want to solve for milliliters an hour. Okay. So at what rate in milliliters an hour should the nurse program the IV pump? And sometimes this is where students make a mistake because they see 250 and they see 90, right? But you got to stop because we're solving for milliliters an hour, and that 90 is in minutes, okay? And so the units don't match. And as you can see, the dimensional analysis is already there. You see the answer, but now we're going to go step by step of how we actually answer this. So get your pen and paper out and let's work through this together. All right. So what is ordered? 250 milliliters in 90 minutes. So we know that the volume is 250 milliliters. So that's going to go in your numerator, right? But what goes in the denominator is hours because we are solving for milliliters an hour. Do the units match? No, because right now you have milliliters a minute, but we don't want that. We want milliliters an hour, right? So we need to convert those minutes into hours. So we know that 60 minutes is an hour, right? So 90 minutes divided by 60 minutes an hour. And think about it, the minutes will cancel out. So you got 90 minutes in the numerator divided by, well, yeah, that still works. Divided by six. So how can I say this? It looks funky on paper, but it'll be like 90 minutes at the top, and then you have a line. And then you have 60 minutes an hour, right? So the minutes in the denominator will cancel out with the minutes in the numerator, right? So you'll have 90 divided by 60, and the only thing that's left is that hour. So that'll be 1.5 hours. So 60 goes into 91 and a half, so 1.5 hours. All right. Hopefully that made sense. So now the problem becomes 250 milliliters over 1.5 hours. So let's set up the calculation. Now we know 250 milliliters in the numerator and 1.5 hours in the denominator. And when we solve it, we get 166.67. Okay. If the pump is programmed to the whole number, and typically on exams, instructors will ask for the whole number, we need to round. All right. And when we're rounding, we need to round to the pump capabilities. We need to round to the faculty policies. And so that would give you approximately 167 milliliters in pump. Now, there's another way to kind of solve this. Students prefer dimensional analysis. So it would be, you'll start with the 250 milliliters over 90 minutes. Okay. But we need hours in the denominator. And we know that there's 60 minutes in an hour. And so how we would set it up is you'll have 250 milliliters over 90 minutes. So you have 250 milliliters in the numerator, 90 minutes in the denominator. And then you'll have the multiplication sign in the middle. And then on the other side, you'll have 60 minutes in the numerator and 1 hour in the denominator. Okay. And what is that going to do? The 60 minutes, the minutes will cancel out the 90 minutes in the denominator. And then all you would have left is 250 milliliters. And then on the other side, you'll have an hour. And so it'll give you milliliters an hour. And I wish that there was another way I could do this. So, I use my hands. But if you set it up, you'll be able to see how you can cancel. And so now you'll have, when the minutes cancel, you'll have 250 times 60 divided by 90. And that's going to give you 166.67 milliliters an hour. And so again, you're going to round and it's going to give you 167 milliliters an hour. Both methods give us the exact same answer. Okay. Hopefully I didn't make that too confusing for you. If I did, let me know in the comments and maybe I can, I don't know, use a whiteboard or something and do this again. All right. So let's use a little clinical judgment. And we kind of talked about this with the last problem. Now we know that we're giving this patient an antibiotic, right? And it's been prescribed in minutes. Okay, it's for the time, infusion time. Um, but you have to realize that if you give it too quickly, it can cause an adverse reaction because it's an antibiotic. And so would it really be acceptable? Like if you're saying, 167 seems too slow. I'm just gonna run it at 250 and it'll be finished faster and I can just go on about my day. Don't do that. Okay? Please don't. The infusion time is part of the medication order. If it says to run it at a certain rate, that's what you run it at. You don't run it faster. Doesn't mean that it's better. And then technically slower doesn't actually mean that it's safer either. Medication administration must follow the prescribed rate, the medication guidance, institutional policies. Okay? Please follow the drug guides and the policies of the facility that you're working at. Because an IV medication has more than just the dose, it also has a rate. Okay. And the right medication at the wrong rate can still harm your patient. And so I'm going to throw something in quickly before we move on to number three. Sometimes you will infuse certain medicines slower. Okay. And I know I just said don't do that. But potassium is one of the ones that you would run slower, and here's why. Now, of course, if you're giving, they call them a K rider. So potassium riders, they come in 100 milliliter bags, right? And you run it over an hour. Okay, so if it's a 100 milliliter bag, you run it over an hour, it'll be 100 milliliters an hour. Okay, you don't want to run it faster because you can cause cardiac dysrhythmias and kill your patient. So you never want to do that, right? However, there are times when you may have to run it a tad bit slower. Now, of course, you have to call the physician and let them know what's going on. And that would happen only when potassium, it's an irritant, I guess. I mean, I know there's probably another way. I can't think of it right now. It really will irritate the vein and burn, it give a burning feeling. And some patients can't tolerate it at 100 milliliters an hour. So you would talk to the provider. If they don't have any other IV access, you don't know what to do. Sometimes they may say, well, drop it down a little bit. We don't want to get too far off of the rate, but the little bit of slowing it down may kind of soothe some of that burning. We put ice packs on, arms and all that kind of stuff because it needs to be run at a certain rate. But sometimes they may let you do it a little bit slower to kind of ease that up. That's the only medicine that I can think of right now where you may run it a little bit lower than the actual dose. Okay, let's move on. All right. So let's do calculation number three. Let's look at one more, something real short, a short infusion, right? Um, So it looks a little different, kind of, but everything basically stays the same. The roadmap stays the same. So it's 100 milliliters over 30 minutes. That's what the provider ordered. And the question always is, at what rate should the nurse program the IV pump? And if you want, now I do have the dimensional analysis on the screen and the answer, but if you want to calculate it out, please do so. But of course, we're about to review it. Okay, so what's ordered? 100 milliliters over 30 minutes. So what are you solving for? You are solving for milliliters an hour, right? Because you're using the pump. So do the units match? No, because they say 30 minutes. Okay. So the time is in minutes. We have to convert the time. So 30 minutes is one half of an hour. Okay. So 30 in the numerator divided by 60 in the denominator will give you 0.5 hours. So when you set up the calculation, you have 100 milliliters in the numerator divided by 0.5 hours in the denominator. You solve it, it's going to be 100 divided by 0.5, which gives you 200. Okay? And so the final answer is 200 milliliters an hour. I want you to understand why this makes sense. Um, Sometimes a short infusion can create a larger milliliters an hour number. And so if you are giving 100 milliliters in a half an hour, If that same rate continued for a full hour, the patient would receive 100 milliliters in the first 30 minutes, right? Plus the other 100 milliliters during the second 30 minutes. So that's 200 milliliters an hour. Another way I used to tell my students was that if you were, I can use it like this. If you were going 100 miles and you were driving 100 miles an hour, it would take you 1 hour to get there. If you're like, I need to go faster, I need to get there in a half an hour, right? So you will go twice as fast. And so you would go, you know, of course, no one would really do this, but you would go 200 miles an hour because it's going to get you there in a half an hour because you're going 100 miles. So I don't know if that confused you more, but that's how you look at it. So therefore, in this problem, the answer is 200 milliliters an hour. And so understanding this way really kind of gives you power over your calculations. And one thing, as you're constantly doing this, it's going to be faster. You're going to be able to calculate this in your head. But it's always good to know dimensional analysis as well. You can do some ratio proportion, like I said before. Okay, so those were the three calculations. So now let's talk about some common exam errors. You know, why students miss these IV pumps. You know, they may use the drop factor. You know, if the question asks you for a basic pump rate, you should know that it's milliliters an hour. You do not look for a drop factor. If it has it in there, it's wrong. Okay. You got to ask yourself when you're reading the question, what units, am I solving for? Okay. They'll divide by minutes. 250 milliliters divided by 90 minutes does not give you milliliters an hour. The unit, you have to make sure that the units match what you're actually solving for. Um, for an IV pump rate, students may multiply instead of divide. So you want the volume to be divided by the time, which will give you your rate. Okay. Um, they may ignore the units. Okay. Never just write the number without writing milliliters an hour. Rounding too early. You want to keep your decimal throughout the entire calculation and then round at the end, your final result. Okay. Um, Trust the pump more than your calculation. Now, this is important because we kind of talked about this a little bit before. The calculation says, let's just say it says 125 milliliters an hour, but the pump is currently running at 1,250 milliliters an hour. Okay. Don't assume the pump's correct because it's obviously not correct. You should know it shouldn't be running that fast. And actually, if it's running, it would just be pouring in. And I'm supposed to be giving this over 8 hours. It should not be pouring into the patient. So your clinical judgment, your reasoning should be kicking in saying something's wrong here, and to stop the pump and correct it. Electronic equipment, and I say this because it does exactly what we tell it to do. So if we tell it to do it wrong, it's gonna do what we say. So you always want to verify an unexpected rate. Okay. All righty. And we kind of went over these. I like to always, because you want to really start thinking like a nurse. Does the number make sense? Right? Is it running at a rate you would think? If something is 500 milliliters over 5 hours, it should give you, if it should give you 100 an hour, right? Because it's going over 5 hours. But if it says 1,000, you'd be like, well, that's more than what I'm supposed to be given. So that should tell you that you did something wrong in that calculation. If your answer sometimes is more than the original order, sometimes, because we know we talked about short infusions, but you should really recalculate and see what's wrong. Does the answer actually make sense? You know, um, your brain should catch it. Your brain should, right? Before, the pump reaches the patient. And that's why, we talk about this calculation roadmap. That's why it's so important. You got to check it. You really don't want to put your patient in a bad situation. All righty. So we got to keep moving. All righty. So let's just hurry up and do this. Not hurry up, but let's talk about this unfolding case study that I have here to kind of put everything together. So you have Miss Lewis. She's 76 years old. She was admitted after several days of vomiting and diarrhea, right? So now, she can't keep anything in. She can't, everything that you put in, it comes out one way or the other, right? She has this medical history. She's got some heart failure. She's got some hypertension, chronic kidney disease, and the provider orders normal saline, 500 milliliters IV over 5 hours. Alrighty. And so the infusion will be, administered using your IV pump. All right. So before you start this infusion, you should assess your patient. Now, when you came in that morning, you should have assessed your patient. And before you provide any kind of infusion, especially to an elderly patient like this, you want to inspect your patient. You want to assess your patient. So you go and assess your vital signs: blood pressure 96 over 58, heart rate 104, dry mucous membranes, decreased urine output. Boy, you do your lung assessment, lungs are clear. Good. No edema, no peripheral edema, um, and so when you have all of these signs, you're like, this does sound like volume, fluid volume depletion. Think about it. They're vomiting and having diarrhea. So all of the fluid is coming out, right? So they have fluid volume depletion. But also, you want to remember this patient has heart failure and kidney disease. So we need to administer and monitor the IV fluid very carefully. Okay. So let's calculate her rate. 500 milliliters over 5 hours. You know what's available. You have a 500 milliliter bag of normal saline, and you're solving for milliliters an hour. Okay. Do the units match? Yes. And so you want to set it up. 500 milliliters in the numerator, 5 hours in the denominator. When you solve it, 500 divided by 5 is 100. So you have 100 milliliters an hour. So the pump is programmed to 100 milliliters an hour. You make sure it's the correct patients. You want to make sure it's the correct solution. Is the volume right? You have the rate right. You assess that IV. We talked about the IV. And so you've done a complete assessment. All right, you're good. So you start that infusion. Yeah, okay. Well, about 2 hours later, Miss Lewis starts pressing on that call light. You come in, you say, "Hey, Miss Lewis, is anything wrong?" And she says, "I feel like I can't catch my breath." First thing you're going to do is assess your patient. You assess her respiratory rate. Now is 28 breaths per minute. Oxygenation status is oxygenation saturation, 89%. You check those lungs, they were clear. Now you're hearing bilateral crackles at the bases. You look, she's got increasing JVD or jugular venous distension. And you took her blood pressure. It was in the 90s before, now it's 154 over 88. IV pump still running at 100 milliliters an hour. Now you want to think, is the pump rate, mathematically correct? Yeah. So what is the most important thing for your patient right now? Is it the pump? No. So what is the most important thing? And this is where nursing begins. All right. So your patient is showing signs of fluid volume overload and pulmonary congestion. Her heart failure, may actually limit her ability to tolerate the fluid load. It may be too much. Her kidney disease may also reduce her ability to eliminate excess fluid. So the calculation, you know, it didn't all of a sudden become wrong because it's not. The patient's condition changed. Okay. And that is extremely important. The distinction will make you a great nurse. Noticing that the patient's condition changed. So what's going to happen? What am I going to do? What do I anticipate happening? Okay. What's the priority? It's not finishing the IV bag because the IV bag, the infusion is part of the problem, right? So immediately assess your patient. We did the respiratory, right? New bilateral crackles. Cardiovascular status, we did the blood pressure, it's elevated. Oxygen saturation, it is 89%. So you want to support the patient's breathing, right? You position the patient appropriately, which would be upright if tolerated and not contraindicated. Okay. One thing I said in an old video a long time ago, I'm gonna bring it in really quick right here, is that when a patient is supine, their body has to breathe against that mattress. Their body weight is on top, it's pushing down on the mattress, and they have to try to expand their lungs against that mattress. When you push that patient up, it removes that gravity. So a patient actually can breathe better. Okay. I mean, it seems strange, but if you think about it, yeah, I don't have that weight, and so they can breathe better. You want to verify the infusion, and then you're saying, okay, this fluid administration is concerning, the patient condition was one way, and now they're the total other way. So you want to look at the patient, you want to look at the orders and verify, okay, is this the right order? And then you want to look at your facility's protocol. You're going to notify the provider. You're going to give them a clear picture of the current condition. That is why it is so important that when you start the unit, when you start your shift, you want to assess your patient, because now you can tell them, well, when I came on at 7 o'clock, the patient was this way. Now it's this way 2 hours after we started this infusion. Okay. And this may prompt additional assessment orders from the provider. If the patient is really symptomatic, you may have to call a rapid, hopefully not. um Maybe some orders from the provider may be enough. Okay. And while you're waiting for those orders, while you have already administered the intervention, you are going to continue monitoring the respiratory status, the oxygen saturation, the lung sounds. I'm going to take the vitals, look at urine output, edema, their mental status. Okay. That's big. You're going to anticipate any other treatment based on the condition, and you're going to be following this patient's condition. You're going to be looking at the doctor's orders, and you're going to report back and document your findings and evaluate and document your findings and let the provider know. Okay. All right. So let's look at the patho real quick. So remember, Miss Lewis originally was dehydrated. You gave her some IV fluid. Made sense. Dehydrated. I'm gonna give her something. I'm gonna give her something to fill her tank, right? But she also had heart failure, and if the heart can't pump effectively, the additional fluid can increase the pressure in the circulation, and that pressure can push fluid into the lungs. So now you have that pulmonary congestion. Then you add on that chronic kidney disease. And if the kidneys can't remove fluid from the body efficiently, you'll have excess volume, which can accumulate more easily, right? And that is why, we always talk about the care doesn't end at the pump. The pump controls the infusion. You, as that great nurse, will evaluate the patient's response to that intervention. Okay, so like we said, so when you're doing and you're evaluating, you've done the interventions, you found out that she was um, dehydrated. Now she's fluid volume overloaded. You did some things, and now you're assessing, you're evaluating after your interventions. Is Miss Lewis breathing easier? Is her respiratory rate, has it improved? Is the oxygen saturation improving? Has those crackles, bilateral crackles, have they improved? Blood pressure, it was low, then it was high. So what is it now? What's her urine output? You know, um, how much fluid has she received? If they change the order, they may have stopped it. They should stop it. But if they stopped it, you look at how much fluid she's received. Did the provider change the orders? Did that work? Because this is the final step in clinical judgment. Did our interventions improve the patient's condition? If not, you're calling the doctor. You're trying to get more orders, or it may be time to call a rapid response. All right. So let's see. Let's see. We're almost at the end. So let's see what you remember. Question one, it was 1,000 milliliters over 8 hours. You set that pump at 125 milliliters an hour. All right. Question two, um, we had 250 milliliters over 90 minutes. And so we had to change the minutes to hours. And so the answer was 167 milliliters an hour because we had to round. And then question three, that was that short infusion. We had 100 milliliters over 30 minutes. We had to change the minutes to hours. And then our pump rate was 200 milliliters an hour. So you know, remember, we didn't use any drop factor for these calculations. We were solving for milliliters an hour. Okay, so no drop factor. All righty. And you have to remember, the basic formula is total volume in milliliters divided by total time in hours. And that is how we get milliliters an hour. So remember, IV pump, think milliliters an hour. Gravity, think drops per minute. You want to make sure those units match before calculating. You never trust the number simply because it appears on an IV pump. You want to verify it. And like you learned with this case study, the math may be right, but it may not be clinically appropriate for your patient. If your patient condition changes after you started an IV infusion or gave a particular medication, that is something that you need to monitor and assess, right? So remember, the pump delivers fluid. The nurse protects the patient. So I want you to calculate this. I want you to put the answer in the comments, please. Um, so the question is the provider orders 500 milliliters over 4 hours. At what rate in milliliters an hour should you program the IV pump? Don't just give me the number, give me the number and the units. And then for bonus, tell me one assessment you would perform while that patient is receiving the infusion. Okay? Sure. So put that in the comment and then I'll respond. So if the IV pump calculations, if it intimidated you before today, hopefully, you're beginning to see that, these problems, are more manageable than I thought, especially if I slow down and kind of organize the information. Don't really always begin with the formula. Always ask yourself, what in the world am I solving for? And for these type of calculations, it's milliliter an hour. So you want to think volume divided by time. Okay. Check your units, complete the calculation, and ask yourself, does this make sense? Right. And you would also want to say, is this safe for my patient? Because you never want to, calculate numbers in isolation. There's always a patient attached to these infusions and these numbers that you're calculating, right? So hopefully, like I said, hopefully this made sense to you. If so, please like the video, subscribe to NurseEdScholar so you don't miss the rest of the stop fear and dosage calculation series. I think I have 2 more left. Um, I'm going to talk about IV medication infusions. Talk about some antibiotics, potassium. I mentioned that today. Magnesium, some cardiac medications. Share this with your nursing friend, an allied health person who may be struggling a little bit with IV calculations. Okay. And I want you to remember, don't just program the pump. Understand the calculation, assess the patient, and think like a nurse. So thank you for watching. And until next time, happy studying from NurseEdScholar.